It's Dr. Kaan of the ACL Academy, and today I'm going to touch on an important part of getting back your knee extension range of motion, and that is working that kneecap and mobilizing it so it moves freely and is able to get out of your knee's way as it is going into the straight position. Before I do that, guys, if you've been following along with us here and you found some value out of the channel, please subscribe to it. Of course, if you have any questions or comments, drop them below. And more importantly, share with a fellow ACLer that can benefit from these videos here. So when we're talking about getting back your knee extension, one of the most important things is, or after ACL surgery, one of the most important things, or if you ask me, the most important thing is getting back your extension range of motion. Okay, which is your straightening range of motion. And a lot of times people are focusing on stretching, the calf, the hamstring. They're doing some weighted stretches into extension, which I love. And I've had some great content videos posted here on YouTube as well. So you could visit those to get even more information on my favorite stretches for the extension work. Today, what I really want to touch on is what most people miss the boat on is the actual kneecap part of getting back your motion. When we're going into straightening, okay, or even bending and straightening, right? When we're going into bending in this position and then straightening this position, in order for me to move through this, my kneecap has to glide up and down, okay? Because the knee joint is really two joints. You have your shin and your thigh, right, which most people know what the knee is. But more importantly, the kneecap sits on top, okay? When we're in full extension, it basically floats, and as we're bending, it comes more and more contact with the bones below. So as I go into straightening, the kneecap glides up towards my thigh, and as I go towards bending, the kneecap glides down. So when I'm working the extension, we have to also work the kneecap in an upward position. We have to what we call kneecap mobilizations, right? We have to do some mobility work here because after surgery, after injury, the tissues surrounding the kneecap itself become bound down a little bit, and sometimes we'll be restricted in mobility. And if we are restricted here, it'll be hard to get that full straightening type motion. Okay, so what I like to do, or what I like to encourage or assign to our clients, is self kneecap mobilization. And these are very, very simple. You will do this in whatever motion you have in the beginning, right? So early on, a week out, your knee may be flexed a little bit, and as you get better and better with the straightening, you'll come down to a flat table, and then eventually we want to get you into hyperextension. But how this works is you would sit in a position like this, comfortably with the legs straight, and basically what we want to do is find the outlines of your kneecap. And sometimes in the beginning, early on, maybe it'll be a little difficult because you'll have fluid in there and it'll look big. So what you can do is just go to the other side, right, and feel around that way. Just get an idea of where it sits, because on the other side, it'll sit in the same place. It'll just be harder to find because of the swelling. But you also, when you do get to the other side, you should be able to feel the movement in the kneecap itself. It should move pretty freely because it's an uninjured joint. So you should be able to press down on it, press up on it, side to side, and get a good idea of how it moves, just to get a baseline assessment. And then you could do the same thing on the surgical leg. So you could find outline of where you feel like it sits, get your hands over it, mobilize up, mobilize down, and side to side, just to get a feeling and comparison. And you could even do both hands at the same time, up just to get an idea, and then down again just to get an idea. That's the most important part of the kneecap motion. As I said, extension, kneecap glides up, flexion, bending, kneecap glides down towards the shin. So when I want to mobilize, okay, what I want to do is I want to take the kneecap to its end ranges, right? So when I find the outline of the kneecap, I kind of want to find the bottom surface. Okay, so you'll feel like a ridge that you'll fall off on, and when you fall off, you'll fall right into your patella tendon. But you should feel a hard ridge. That's the bottom surface of your kneecap. You kind of want to get your fingertips just underneath it. Okay, so this way you could traction up. And when we're mobilizing, we want to take our fingertips there. I'll even take the other hand, put it on top, and we can get a nice self-mobilization there. And if you look closely, like, you'll see my skin moving because I'm really generating a lot of force. It sometimes feels weird for people mobilizing their kneecap because it just can feel like icky, right? It's just a weird type feeling. So it is something that you may have to get used to. But at the same time, don't be afraid to mobilize. When I see this taught, it's usually taught wrong because most times it's taught to just gently kind of pull and tug and instructed to just say move it around. That's not the case. We have to be fairly aggressive here. We got to make sure we're going to the end range here, and we have to make sure that we're continuously hitting those barriers. So basically, fingertips underneath the ridge, other hand on top. We're going to traction and pull. Okay, when we traction and pull, we're going to get to the end range, and you should feel almost like you hit a wall. Once you hit that wall, you just want to back off the wall a little bit and then keep hitting the wall. So we're almost pulsing. And basically what I'll say is you want to pulse for 30, 45, 60 seconds, really till you're fatigued. And we're going to continue to hit those barriers and pulse at those end ranges. Okay, once we're done with about 60 seconds or so, we take a little break. Then I would probably repeat this 2 to 3 times. After you're done with this, then we will actively contract it. Okay, and I'm just going to get to that in a second. A couple tips for this. Sometimes our hands can be a little oily, right? Skin on skin, and will slip. So one recommendation that I do make is if you have a TheraBand at home, this is great for traction. So you place the TheraBand right over the kneecap, okay? And then take your hands on top, and you'll see you'll get a lot more of an aggressive stretch here because you won't have like the skin to skin oily contact and be sliding off. This provides good traction and you can get a good amount of force there. Again, I'm pulling all the way to end range and I'm just backing off slightly and I keep hitting that end range for an aggressive mobilization there. 30, 45, 60 seconds until I'm fatigued. You take a little break and then you repeat 2 to 3 times. So I may spend 2 to 3 minutes just mobilizing, getting that kneecap moving. Now, after I get the kneecap moving, well, what's next? We want to activate our quad muscle, right? The reason we want to do that is our quad muscle is this big muscle in the thigh, comes down, covers the kneecap here, turns into a tendon, right? So it's going to envelope the kneecap. And this, when the quad muscle is activated, it's going to traction the kneecap up. Okay, so it actually pulls the kneecap up. So after we mobilize, best way to activate and encourage that new movement is to get our quad sets going. And quad sets are very basic. What we want to do is push the back of our knee down to the mat, get a good quad squeeze there, and you'll feel it activate. You could hold 2 to 3 seconds and then relax. And we would do this maybe 2 sets of 10, 3 sets of 10, right? Just encourage that movement, okay? So first we mobilize, then we'll activate. And a little bonus tip, we could do the mobilization while we activate. This is called the mobilization of the movement. Very basic, same thing. You'll take your TheraBand, put it over the kneecap here, okay? Come on top, fingers grab the bottom ridge of the kneecap, other hand on top here. And now what we're going to do is we're going to traction up while we activate our quad muscle. So we're going to pull up, activate that quad, hold 2 to 3 seconds, and then rest, relax. So now we're doing like an active assist, right? We're assisting our kneecap as we activate our quad muscle. So we're getting probably a little bit more movement there and just a little bit more comfort and almost like a relearning process, a re-education process of how the kneecap should move along with our muscle activation. So it's a combination of all three. One is just the passive movement, right? We mobilize. Then we have the active assisted movement where we can assist the kneecap up as we activate our quad muscle. And then after that, right, as I showed you before, just activate our quad muscle alone. We'll re-educate, relearn how the kneecap should be moving. Now, these are super important to do, just like we do our extension stretches, which are very important. We do want to mobilize, and I would suggest this to be done daily, especially early on, in order to get your extension range of motion back. So hope that guys give you some insight in how we do things here. Extension, as I said, is super key early on after surgery. We have a couple previous videos that I posted about some of my favorite extension stretches. I touched on the kneecap mobility there as well, but this particular video goes into more in-depth detail of how we want to mobilize the kneecap when we're working into extension. And we want to do this stuff daily. It's a combination of passive hands-on mobility, active assisted, as I showed you before, where we're activating our quad muscle and tractioning the kneecap up at the same time. And then, of course, after, just activating that quad muscle is going to reteach, repurpose the sound movement of the kneecap that we're looking for there. Hope you guys found some value in this video. If you have, please like it. Please subscribe to the channel. If you have some questions or comments, drop them below. And of course, more importantly, share with a fellow ACLer that can benefit from these videos. I'm Dr. Kaan. I'm here dropping a new video every Monday, and I'll see you next time here at the ACL Academy.